Welcome to This Week in Neurology. This week we're covering 7 notable papers spanning stroke and neurovascular care, multiple sclerosis, headache medicine, and movement disorders. Let's dive in. Beginning with vascular neurology and acute stroke care, several trials address the nuances of reperfusion, blood pressure management, and cerebrovascular complications. In a systematic review and meta-analysis, investigators evaluated intravenous thrombolysis beyond the standard 4.5-hour window from last known well. Pooling data from 13 studies comprising nearly 4,900 patients, intravenous thrombolysis significantly improved excellent functional outcomes with a number needed to treat of 13, and increased good functional outcomes and reduced disability without raising all-cause mortality, though it was associated with an increased risk of symptomatic intracranial hemorrhage. For clinicians, this supports extending intravenous thrombolysis to selected patients presenting in the extended time window using appropriate imaging selection. However, post-procedural management requires caution. A secondary analysis of the optimal BP trial. Patients randomized to intensive systolic blood pressure control below 140 millimeters of mercury experienced roughly double the risk of acute kidney injury within 7 days, compared to conventional management targeting 140 to 180 millimeters of mercury. Furthermore, acute kidney injury was strongly linked to worse neurological outcomes and significantly lower rates of functional independence at 3 months, highlighting that aggressive blood pressure reduction can induce systemic hemodynamic vulnerability. Expanding into global health disparities, another analysis. While high-income country trials show comparable endovascular benefits across age groups, this study found that age significantly modified the treatment effect. Non-elderly patients derived substantial benefit, whereas the benefit was significantly attenuated in elderly patients aged 70 and older, and very elderly patients aged 80 and older. Clinicians caring for socioeconomically vulnerable stroke populations must account for resource-limited settings when assessing procedural utility in older adults. Shifting to pediatric cerebrovascular disease, a multi-center retrospective cohort study published in Stroke investigated Down syndrome-associated moyamoya syndrome compared to non-syndromic moyamoya syndrome. Children with Down syndrome-associated moyamoya presented with stroke as their primary symptom in over 70% of cases, substantially higher than the comparison group, and experienced longer diagnostic delays along with greater one-year disability and spasticity. Notably, children with Down syndrome-associated moyamoya demonstrated a progressive rise in systolic blood pressure percentiles beginning 6 months before diagnosis, pointing to an early physiological signal that should prompt a lower threshold for vascular imaging in this high-risk population. In multiple sclerosis, a cohort study and emulated target trial utilizing MS-based registry data across 26 countries explored the impact of clinically silent magnetic resonance imaging lesions on treatment-naive or moderate efficacy platforms. Patients with silent lesions faced higher 2-year cumulative incidence of relapse and disability worsening compared to those without silent lesions. Crucially, in the emulated trial of over 2,200 participants, disease-modifying therapy escalation within 6 months of a silent lesion reduced the 4-year cumulative incidence of relapse substantially compared to treatment continuation, though disability accumulation progressed at a similar rate over 4 years. These findings challenge current guidelines and suggest that treatment escalation should be strongly considered after either single or multiple on-treatment silent lesions. In headache medicine, a Phase 3b trial published in the Lancet Neurology compared oral calcitonin gene-related peptide receptor antagonist atogepant head-to-head against topiramate over a 24-week double-blind period in adults with migraine. Treatment discontinuation due to adverse events was markedly lower, with atogepant at 12% compared to 30% with topiramate, and treatment-related adverse events were less frequent. Moreover, a greater proportion of participants achieved at least a 50% reduction in monthly migraine days on atogepant than on topiramate, confirming superior tolerability and efficacy for oral CGRP inhibition over conventional nonspecific prophylaxis. Finally, in movement disorders, a prospective Phase 2 trial. Medically refractory essential tremor. Following staged procedures with a mean delay of over 2 years, tremor severity scores improved by nearly 60%, disability scores by nearly 85%, and functional impact scores by nearly 69%, with only a single adverse event observed and no significant cognitive, speech, gait, or balance worsening. For selected patients with bilaterally disabling tremor, staged bilateral thalamotomy represents a viable and safe therapeutic option. If you only have time for one paper this week, make it the Temple trial, comparing atogepant directly to topiramate. It provides landmark head-to-head evidence that modern oral CGRP prevention not only halves treatment discontinuation rates from adverse events, but also delivers superior migraine day reductions compared to legacy therapies, fundamentally reshaping first-line preventative choices. Here are the key takeaways from this week in neurology. Intravenous thrombolysis in the extended time window significantly improves functional outcomes in selected acute stroke patients, despite a modest increase in symptomatic hemorrhage risk. Aggressive blood pressure lowering below 140 millimeters of mercury following successful endovascular thrombectomy nearly doubles the incidence of acute kidney injury and correlates with poor 3-month functional recovery. In relapsing remitting multiple sclerosis, detecting clinically silent magnetic resonance imaging lesions should prompt active consideration of disease-modifying therapy escalation to curtail future relapses, challenging restrictive guidelines. Atogepant demonstrates superior tolerability and efficacy over topiramate, positioning oral CGRP receptor antagonists as a preferred first-line preventative strategy in migraine. Staged bilateral thalamic radiosurgery can achieve substantial tremor reduction in medically refractory essential tremor without inducing severe cognitive or balance deficits in carefully selected patients. That's your roundup for this week in neurology. The full transcript and references are available on the episode page in your Audio Scholar library. This is an AI-curated summary. For clinical decisions, always consult primary sources and current guidelines. See you next week. If this weekly briefing is useful, follow the show in your podcast app so new episodes arrive automatically. And for audio briefings on your own clinical questions and papers, visit audioscholar.cc. This is an automated summary generated by artificial intelligence which can make mistakes. Always review the original source materials.